Hello, everybody, and thank you for joining our webinar. We are tackling, obviously, a very hot topic right now in the COVID environment that we're living in, as healthcare has moved tremendously into needing technology, telehealth and telemedicine platforms, regulating and kind of finding a consistent level of data across all these different platforms. And we're here today to talk about how to make your EMR implementation successful for healthcare providers. We are Archer Software, owned by Cprime. Archer is a software development company, and Cprime is an agile transformation and consulting company. And together, we provide tremendous benefits to our customers and clients in helping them both with their business transformations and the actual development and launch of their products. So today we are very excited to have Dmitriy Vinichenko, a senior project manager at Archer Software, and he's going to tackle efficient data management in EHR and EMR development. And after Dmitry, we're also very excited to have Noah Lance with us. He's a security and DevOps engineer at Cprime, and he's going to talk about HIPAA compliance and electronic medical records. Obviously, very, very important when you're dealing with medical information that has to be secured properly and all that fun stuff. And then myself, I'm going to be talking about working with EMR and health IT developers from requirements to system launch, and that whole process of how you take your your idea in the healthcare industry and how do you actually get it to market as a viable product and as a viable business. So first off, we have Dmitry Vinichenko.
Hey, hello everybody. First of all, like Brian said, my name is Dmitry, or Dima for short, if someone will see that on the contacts later. I'm working with Archer for almost 10 years so far, not only with medical projects, but yeah. And let me start here. And first of all, please let me apologize for number of word data which you will hear on my speech, even in the single sentence, but there were no way to avoid that. As almost, let's go from here. There we go. As almost everything developed by different groups of people, and sometimes even the same group of people, all data sources are somehow different, significantly different, and even dramatically different sometimes. Many organizations choose to customize their systems to fit local operations, realizing too late that they had opt out of workflow that would have collected data in a clean, consistent, and reusable way. Some of them missed opportunity to critically evaluate business, automating bad business practices that led to the bad data collection. Other organizations made poor choices inserting mandatory fields and appropriate times during the patient care, which led to workarounds and bad data capture. And all of that led us to need to combine sometimes dramatically different data. And since it is also highly sensitive data, we still need to do that with the highest grade of data quality. So what is the meaning of data quality? It can be defined in various perspectives, but the most impactful aspects of which are accuracy. The extent to which data captured in a medical records accurately reflects the state of interest, which is often complex to measure because the true value of a given variable remains unknown. Then completeness. The level of missing, for any reason missing, data for a particular data element in the EHR for the population of interest. This is commonly measured as a data quality indicator for EHR, and it is important to note that for research purposes, a distinction is made between must-have and nice-to-have data. Of course, recognizing that completeness of must-have data is more important. And it is also timeliness. Well, That's pretty much obvious. That's the time between the initial capture of value and it's a time between the initial capture of value and the time it will be available for you on EHR system or for end users on the system. So there are many ways to achieve good results here. And while none of them is written in stone and require some additional research and tons of adjustments every time, but everything starts with the basics. And first of all, when working with medical data, we need to determine which type of data we're actually working with. It seems somehow obvious, but in reality, not that much. So, there are a few different types of data on the medical records, which includes but not limited to patient identifiers, demographics, diagnosis, vital signs, medication, social data, structured data, surveys, laboratory data, procedures. While things are quite easy, let's say with the demographics data, many people can extrapolate that experience to all medical records, and that may be a fatal error because each data type will require some specific approach to be processed. I will not give many details here as it would require a separate webinar or even a set of webinars to talk about each type of data separately. But I will give you just the basic ideas. However, if any of you guys interested in more exact details or examples, and maybe some of you want to solve already existing specific problem, please feel free to reach me out. Contacts will be posted at the end of the presentation, and I will be happy to talk about any problems you may have. So let's talk about let's talk a little about those types of data we have and the most common problems they may have. Patient identifiers. Well, the biggest problem here is actually matching rules. Sorry, let me change the slide. Yeah. Matching rules. This type of data is quite common and easy to map, but the biggest problem is to define the matching pattern. So you will match this data from different sources, and you will be sure that it is the same patient you're referring to. Yeah, you should be really specific when you're defining what to consider as an exact match. Let's say an example from the slide. So you have a first name, middle name, last name, date of birth, address of the patient. So what would be the criteria for exact match here? Should it be just first name and last name? Well, quite obvious, no. 3 of 5, 4 of 5, well, maybe, or it should be some of those fields are more valuable than others, and the formula should include some index of importance. Well, that is actually very true. Let me share with you some nice story. I mean, that really happened to me a while ago when I was just applying to the college, and I saw my name on the wall being accepted to the faculty I never actually applied to. It was exactly the same first name, last name, day of birth, day, month, year, same city, obviously. The only difference was on the middle name, and even though the middle name was starting with the same character. So if anyone will get down to abbreviation, it will be absolutely the same person. And for a decade or so, we ended up receiving mail for each other, some deliveries for each other, because obviously people on the delivery system, on the mail, was not paying too much attention to what they're having on the drop down. And I'm pretty sure this nice cake my grandmother sent me once and I never received, I'm pretty sure I know where it is. But let's get back to our data types here. So next data type, patient identifiers and demographics. Another problem here is also quite predictable. It's a data format. The patient age may be given as his date of birth, or for example, exact number of years by the moment of appointment. And yes, someone may do that. I personally saw that on a couple systems. Have no idea why it was designed like that, but it was. Well, but still, after all, it's quite simple to manage with this problem, and just doing the basic math. That's it. Small tip here: don't forget about data format. It's ridiculous how often it is a reason of a lot of different problems, and probably 50% of the problems we were solving for somebody on their systems was because of that. Okay, things are getting a little more complicated. Diagnosis. Since diagnoses are one of the most important data, the quality of diagnosis data is often acceptable, in part due to the various mandates to collect this data accurately. To map them, it would be better to use some established vocabulary standards which are available to encode diagnosis data. Those vocabularies are public, well, most of them. And they are updated on the regular basis. Here on the slide, you can see examples of those vocabularies. I will not read them, as if anyone need them, you can just take that from the slide. Medications. Pretty much the same as diagnosis. Common vocabularies for them are on the screen. I will give you a second if anyone is reading that part. And procedures. While procedures themselves are well standardized, this type of data may not have expected or needed level of details, such, for example, as the techniques of performing the procedure. All extra information about procedures may be given separately, and actually usually is given separately as unformatted data, and we will touch that a little later. Also, different providers or clinical workflows may generate different data values for the same event or fact in the same clinic. So therefore, the same fact or event may be represented differently even in the same EHR. Another unpredictable part here is the level of risk, which is also never given well on this type of data, and that should be collected, analyzed by developers to improve data quality. So be prepared that you will need to look for this extra information if you want to achieve maximum data quality, and sometimes it's going to be quite challenging and will require some additional research on data set you are receiving. Some codes here. One of my most favorite data types is laboratory results. While they're quite understandable, and I mean, it is not really that complicated to work with them, but they have extremely specific problem. The thing is that currently there are no mandate laboratory coding system for certified EHRs, which causes a lot of complications when merging data between different clinics or lab networks. There is no actually solution here rather than accurate research on data with a team of specialists, and the good documentation from the laboratory and reliable support would be vital at that point. Coding standards, some of coding standards, none of them is actually mandatory, but some of them you can see on the slide. And if you guys are working with this type of data, just a small tip, quite obvious for some people, but not obvious for others. Don't forget that certain lab results are protected by federal and state laws, and they will just not be populated. So if you're looking for them and they're not there, maybe they're just protected. Let's skip here vital signs surveys, as surveys social data, as they're quite common and they don't have any unique problem rather than ones we already stated. And we're getting to our final list. our champion of problem causing. So unstructured data, mostly present on the system as a free text field. This is a very often used type of data. And the thing is that unstructured data limits the usage of automated computation methods and increase the likelihood of low data quality when importing and extracting data from structured EHR records. There are many legit reasons to use unstructured data, but actually overusing it in many cases is just a sign of weak architecture. The loosely structured free text, it is somehow effective in day-to-day clinical workflows, but presents a major challenge for automating. And yes, temptation to use this data is very strong, but however, it should be avoided as much as possible to guarantee the quality of your data. Solving that problem has no patterns, and having a strong dev team who may work on parsing and of this unstructured data and comparing that with all existing possibilities is a key. Okay, so what everything stated before may mean for us here and now. If your business does not require mixing of tons of data from dozens of different sources, but you just need to combine a few records, or maybe you need just to receive some lab results and that's it, or you're starting merging the data, you're going to this structure and you surprisingly see that there is not that much difference between data sources. Well, you're lucky enough to solve this problem quickly. In this case, you can always put this task to a trusted dev team. Doesn't matter would it be internal or external developers. That's it. But if you don't have an answer, or if you don't understand the question, then it is a good sign that you need an internal specialist with experience in data processing and medical data regulations. So to plan this scope for you, and which is most important, with you. Just main things to remember here when you're starting this part. You will need to go through your data structure to determine data normalization rules for each data type, according to what we spoke about before. Then make sure you're using proper tools for data normalization, and accept the fact that sometimes they should not be best, but must be best fitting for the situation. That it really happens. Make sure that all conflicts and mismatches are properly logged and regularly reviewed to increase data quality. Evaluating data quality, completeness, and accuracy should be considered as an ongoing process and not one-time exercise. If you don't have enough, if you don't have perfectly working fortune-telling crystal ball, you will really depend on the depth and comprehensiveness of the vendor documentation. And when you're just beginning, it is a good moment to check with the support too about any question you may have at the moment. Their answers and willingness to cooperate may evaluate your decision about them. In future, you for sure will depend on them and on their help. And it is better to find out that they're not good enough at the very beginning and probably go with another provider, if it is an option, of course, before investing too much money and time on this one. There are no guarantee that things will not change on one of your sources. So you need to plan some resources to support as well. And don't forget, it is a continuous process, and depending on the goals and side of your business, it may take starting from a few hours a month to a dedicated team working full time. So be prepared for that. Okay. Um, now just a little bit about interfaces that are working with medical data. So somehow we managed to get all the data we need, but now we also want to keep the data quality on the level we still need, right? While I would not touch here the most interesting part of that, such as standards, regulation, and in particular HIPAA, as Noah will not forgive me for stealing his speech, I would like to talk a little bit about general rules about making UI and UX around medical data. And once again, you will not find any panacea here or too much of tech details, as it is not a purpose of today's speech, but I would be happy to discuss in person once you will reach me out and ask any questions you may have or share with me any problems you already have. Just, yeah, contacts will be on the end. So, some tips for data processing and storing and editing. And first one is properly restrict access. Obvious, oh yeah. Often done wrong or even totally missed. Oh, you bet it is. Planning in advance would really help here. So carefully think who can and should see and do with what. Just an example. Should practice administrator be able to delete the record saying it was just created because he just created a duplicate? I will give you a second. And well, in most cases, rather than you yourself as an owner are also working as an only one administrator, the answer is no. You know, the road to hell is made of good intentions, and absolutely the same here. If you need to ensure data quality, only ones who are most affected by quality loss should be able to actually edit this data. And yes, I do understand sometimes it may be frustrating to get confirmation about deleting item from, let's say, doctor, whoever is the most responsible for that. But in reality, we really need that. And if you are thinking that administrator will use delete button only to delete duplicates or delete accidental creations, if they may happen, you're mistaken. No, they will use it on the way you will never predict. Next one. A little more interesting. Don't actually delete anything. If you're deleting something on the system, just mark it as inactive on your database and hide from general view from all the interfaces, but never ever delete. If your system is growing, to clean up the system, you can always, all inactive data periodically move to another storage. So you will still have access to that, but it will not slow down your system. This process can be easily automated, so it's not really a big deal. But trust me, a couple of extra bucks for storage is nothing in comparison with efforts it would save you one day. Okay, request confirmations for critical actions. Sometimes just common messages like, are you sure you want to delete something? Yes, no, is just not enough because user may hit the enter without any second thought. So for some cases, it is actually really important to ask for a reason for doing something without opportunity to proceed before giving this actual reason. And well, yeah, most of the reasons will be just duplicate or even just couple periods, but that will guarantee us that this deletion user made intentional and just not by accidental. Next one, do not overload interfaces. Well, you may ask how this is related to data quality, but trust me, it definitely relates. So here on the slide, you may see the screenshot from the real system I personally saw. I mean, there is no jokes. That's the real interface someone created. The point here is actually too many charts, fields, and buttons on the same screen will not help users to work more effectively. Some designers may think, okay, the more data user will have at the same time, the more fast he will be, the more the more data he can read, the more data he can, the more results he can put to the same screen, saving time for the navigation. But no, quite the opposite. The more you have on the screen, the more user will be confused, and therefore the more likely he will put the wrong data on the wrong field or just hit the wrong button, which affects data quality a lot. So the good practice here would be to make a transparent hierarchy of interfaces with a quick navigation between them. And skilled UX specialist would be much of help here, especially at the very first stages of development. He will be helpful on later stages too, though, but it's always easier to plan than to fix existing problem. And one of my most favorites, log everything you can, literally everything, especially when it is about clients' actions related to editing or updating data. It is not because users may do something wrong. It is because users will do something wrong. And they will never accept they did it wrong. They will just blame the system. Like, okay, what was that warning? EMR is opened in read-only mode and changes will not be saved. Ha, whatever. So wait a minute, where are my changes? Oh my God, your system is so broken. Did you ever hear that? I bet you did. So as much as database and common sense allows, there is no such thing as a useless log in any medicine-related project. And quite a funny story here, which really happened to me and my team a while ago. User was constantly coming to the product owner and claiming that I've created a record, but then it disappeared. It was there, then it disappeared. So we were making a search, but ended up also adding some logs to check this thing. Then he came again and said, okay, I entered the data, but it's gone missing. So we were checking, and a lot of other claims like that. Ended up, we found that a couple administrators were navigating through the EMR just by tab and accidentally pressing the button close to the tab, like Q, which replaced the text on these fields. But that's not the point. So we ended up with the product owner making a decision to log everything we pretty much can around this user and inside the system, just to be protected from such kind of claims. And a couple years later, we were rolling back the backup for this project to restore the database because we had a problem, and we ended up having the database servers gone dead. I mean, it could be fixed with the time, but time was extremely important, and we just had no time to fix the database server. So we were in a panic, and I was thinking hard, and then it was quite a weird idea that came to my mind. So I asked my senior developer, and we checked that, and yes, we literally restored the whole database for the whole project just using logs. That was the level of the log we had on this project, and it worked. After all, it worked. Well, also tons of others do's and do nots, but I think I have to finish here and give Noah opportunities to talk about more interesting things for you guys. So thank you once again. Please feel free to contact me if you have any questions or you want to discuss something very specific. I would be happy to help you. Thank you.
Dima, that was awesome. Thank you so much for sharing that great information with everybody. I will say, if anybody has any questions, please feel free to reach out to us via the chat, and we will definitely get to your questions, if not now, then at the end of the session. So Dima, great information. Thank you so much. Now we're going to hand it over to Noah to talk about HIPAA compliancy and security and all that fun stuff. Noah, you're up.
Now I am. Now can you hear me right?
Yes, Noah,
awesome.
Thank you.
Yeah. And as always, you know, we're all great IT guys who can't figure out how to use the mute button. So that's my fault on there. Apologize, everybody got a delay. So we're going to go through and just kind of cover a couple basics on here. So now I have kind of a background in various areas with the healthcare system. About 10, 12 years ago, I started doing a lot of work with patient quality care, quality assurance type programs, where we look at building systems to help identify problems proactively versus having patients going in and finding out about something wrong and then connecting them together with several different doctors or clinicians across maybe the US, sometimes across the world at times on there. So it actually provides a lot of interesting aspects, and a lot of the stuff, as Steve spoke about, lines up with why we have a lot of the regulatory and compliance risk out there with managing that data, just because there's so much collaboration going on when it comes to patient healthcare overall. So we'll go through and cover a couple of things. We're gonna look at the, just a quick brief on the healthcare information technology on there. Then we're gonna look at some of the concepts of compliance risk that are out there. And then we'll walk into a little bit deeper aspect of how the electronic medical records and health records and patient health records work and what they're defined as, and where a lot of the work is moving forward with on how we use them. And then for a couple of things about looking at the integration and usability of electronic healthcare records. Just we'll go to Cprime overall on here, so we'll go through this real quick because it's not as important on there, but just to kind of give everybody an idea of what Cprime and Archer Software does throughout there, where we work within the world and all the different areas we cover. So we do a lot of interesting work. Our main focus, as you see with this webinar as well, is just really about the knowledge sharing and making sure that we can help companies do what they need to do as well, help improve everybody's knowledge out there and the areas that we specialize in, where when we know something, we want to share it with everybody else as well. So we like to partner up a lot of times with wherever we can, partner up and try to understand the knowledge sharing piece going through and talk with, so both we can learn as well, understand all of the potential aspects out there, and then also share what we know with everybody else. So as we get into the healthcare information systems out here, so it becomes a little bit of an interesting aspect, and we'll go through this fairly quickly just to provide some sort of background on the compliance and regulatory risk that we're going to look at. Because really, to be honest, you can go from 100 controls to 3,000 different information security controls that need to be in place, depending on what type of work that you're doing on there. So when we look at a healthcare system, a lot of times one of the differences in comparison to a lot of other industries is we're actually looking at, and here we give kind of an analogy when we look at a family physician who refers a patient to a surgeon for something, and then they require some tools, or maybe they require a whole new chair or lights or anything along there, so then they need another vendor. So all of this combined together actually builds what we consider a healthcare system on there, and looking at all these organizations. And each one of these organizations are typically going to have some accreditation from the Joint Commission International. So, and this was started out probably early 2000s on there to help enforce a certain level of quality with how we manage the data with healthcare systems and respecting the privacy that goes along with providing healthcare. So one of the things we look at when we kind of walk through there, and it's a part that's a little bit convoluted. So when we look at the Food, Drug, and Cosmetic Act in the US especially, we look at how the FDA identifies different controls on here. And it becomes kind of interesting because we don't always consider software to be a regulated device, but it can, right? So when we look at these class 1 devices, for instance, they're subject to different controls. So class 1 is kind of our lowest level, essentially, of what controls we need on different devices, and potentially applications to be built. So this could be repair, maintenance, how the devices work, the whole manufacturing practice of a device, which in some cases could be the software development life cycle as well. And then as we go further along the line, we look at class 2 devices. So these have special controls on them, and they're things to assure safety, effectiveness, and that they're a little bit higher. So this has something like when we look at a heart monitor, for instance, it's something that we want to make sure that it's not going to break down easily. However, it may not cause the death of a person. Now, when we get to class 3, this is where we're getting at critical aspects. So this is something like a incubator on there, artificial heart, life support systems. These are systems that if they function or not working, or if they are easily, if there's potential to hack them somehow, if they're exposed to the internet, then they would actually cause death of patients on that. So when we develop some software, we have to keep in mind when we look at utilizing EHR, electronic health records, and look at patient quality systems, that there may be potential that this software might fall as a device from certain regulatory and legislative specs, depending on which country you're in or in which state, sometimes all the way to what type of work is actually being handled, what kind of data that's being handled. So for the most part, when we look at healthcare IT, we're going to treat it the same as we would supporting any other industry. We're going to apply the same confidentiality. One day I'll be able to say that word the first time right, but it's been 20 years and I still can't do it, as you can see. Integrity and availability on there. So we practice the common CIA rule of managing security with the healthcare industry as well. The bigger parts that we're going to look at is the network security is going to be more significant, as well as physical security. And it's due to the factor of the type of devices, the facilities, and the amount of paperwork that is stored in order to provide healthcare requires a significant more physical security controls. So this is looking at being able to provide full camera caption systems, auditing everybody that comes in, having some sort of log IDs for actual employees that have pictures on them and are registered with that facility, having active security guards that are out there 24/7. So it becomes a big part on there. With the network security, the factor that a lot of the devices that are provided throughout a clinical provider are connected to some sort of network. If we want to make sure that network is not accessible from the public, because that provides an easy vector of attack to potentially critically injure somebody or cause an immense amount of problems. And also provides access to a lot of personnel data that is fairly valuable on sort of the darker black market side. The rest of what we look at in the solutions that we use in the healthcare industry are going to be the same. So the network architecture, server client-based type systems. One part we look at is a lot of the enterprise resource planning systems are going to contain a lot more sensitive data than you'll see in most industries. And that's because of the factor that they do contain a lot of the electronic healthcare records as well as the business records. Part that is significantly different in the healthcare is that we have a healthcare information exchange out there. And Dmitriy touched a little bit on this as well. We're going to talk more about this and how the controls and the reason it's out there and how it works and why it's different than a lot of other data exchange systems that are out there in other industries. But one of the key parts as we covered and looked there is to reduce the size of duplication and data integrity issues as well, and improve patient care amongst the different organizations in the healthcare system. A lot of times when we look at, so specifically when we look at radiology, for instance, the doctors will prescribe certain types of treatment plans, but in order to validate that treatment plan, it goes to another doctor who is not part of the same organization. And then from there, it'll go to a third one to validate that they all three agree on a care plan that they're coming up with, and that the calculations, what they're doing, that it is of a certain level of quality. So with having electronic healthcare records and the healthcare information exchange, we're now able to provide something we're able to expedite this treatment plan, and the doctors can communicate, see all the data at a larger level versus overnighting a paper file or shipping it in a format that may not be acceptable and in an unsecure method. So now we'll touch on some of the compliance concepts on there. So this is just going to be an overview of looking through some of the main organizations, some of the legislation that's out there, some of the different accreditation standards that are out there. So when we look at the healthcare systems and the different ways that we can secure the systems and design them in secure ways, there's a lot of different organizations that are going to be overlooking there. And it provides for a huge amount of regulatory risk. When we look at regulatory risk, a lot of times what we're looking at is the factor that laws change, legislative aspects change, that makes maybe something that we're doing day to day, now it's no longer legal, or there's some sort of compliance risk in place where we're actually going to lose business, we potentially are going to pay fines, or we're putting our clients at risk. And it's one of the things that makes the healthcare industry very difficult, and especially now with the amount of privacy law changes and a lot of the, looking at how different countries are communicating, the restrictions on travel, restrictions on trade, also ends up impacting us in the aspect of the healthcare world with the regulatory risk on it, because overnight some of these laws are changing and we're not necessarily made aware of it quickly. So, and these are just a couple of them. I think for the most part, most will be familiar with all these organizations. One of them that is a little bit newer for the US side especially is the Office for National Coordinator for Health Information Technology. So this is actually the Health and Human Services under federal government, and they are the coordination in between multiple different groups that are responsible for public health throughout the United States. So, and they also do a lot of work with other countries, such as the Canadian Health Institute as well, and exchanging data, providing standards, and a lot of knowledge sharing on them. And then we look for also with the CMS side, you'll see that a lot of regulations come in place because of the Centers for Medicare and Medicaid Services, despite a lot of people really don't view that, they're not using it necessarily. We generally look at, so that's our senior care, our state health care level on it. For a lot of it though, it actually drives a lot of the controls and security that's in place in the healthcare industry. And then we had the Office of Civil Rights, who is actually part of the enforcement rule of the Omnibus HIPAA combined rule. Is so anytime there's a fine or violation and breach notifications on there, Office of Civil Rights is who is going to enforce that on behalf of the federal government. So this is some of the legislation we look at. So we have Title 45, which is the federal or code federal regulations on there. So, and this is the parts. So part 160, 162, 164 is actually what defines HIPAA overall on there. So this includes these transaction code standards or rules, identifier standards, the privacy rule, security rule, enforcement rule, breach notification rule. So these are all the different rules part of HIPAA overall. And then we take the American Recovery and Reinvestment Act, which has the Health Information Technology for Economic and Clinical Health Act, which I'm extremely proud to say that without stuttering. And that's considered high tech. So one of the parts that they did is they stuck this in as part of the American Recovery and Reinvestment Act. And the high tech part actually covers a lot of the requirements for electronic health records. The design was to provide incentives to promote healthcare information technology advancement. and get a lot of the healthcare providers and clinician providers to upgrade their systems to start utilizing technology properly. And so the next fun one on here is the 21st Century Curses Act. So this act was put in place to help fight opioids, another word I'm gonna struggle on, but opiate addictions and a lot of behavioral health aspects. So it was really looking at different problems with a lot of heroin addiction on there, opium addictions, and how it was becoming a larger widespread problem. However, what they also did was sneak in meaningful use of electronic health card records. So a meaningful use is a rule that mostly applies to the CMS side, so it's the Centers for Medicare and Medicaid. However, a lot of outside you will see companies will try to follow the same aspect and send controls in place on it. So as you go through, you'll want to look at these different acts on it and see the controls they have in place. So even though they may not apply to the private public sector and more towards the government organization sector on there, if you're able to meet these same qualifications and put these controls in place, you're going to be a lot more safe, and you're going to have a lot easier time providing services to the target demographic for whatever the solution is on them. So when we go down, we also look at the Omnibus HIPAA final rule. So this took the American Recovery and Reinvestment Act, along with some parts of the 21st Century Curses Act, and HIPAA, the original under Title 45, and essentially superseded some of the key rules, being the breach privacy enforcement rules, making a little bit more stringent and essentially providing a lot of encouragement for covered entities under the healthcare industry to do what they're supposed to do and utilize electronic healthcare records properly to move forward with using technology and versus using paper type systems, and as well enforcing a lot of privacy aspects and enabling patients to control their data versus having the clinic control the data. So as exciting as this is, and so we'll go into the accreditations part. So these are just some of the standards that are out there. They are helpful. They are not always going to be enforced. You may touch a little bit as well on these. So when we look at the conformity schemes, so this is actually looking at the controls and the standardization, how the data should look like and be managed. So if you're designing a solution that leverages electronic healthcare records, then this is something you want to review. However, it is ISO IEC, meaning that you're probably likely going to have to pay to have access to this information, at least a good part of it, right? And then we have the general requirements for comprehensive testing and calibration laboratories. So this also becomes helpful in a lot of different areas. So when we look at the actual development, implementation of controls for electronic healthcare record systems, this is going to be significant. It may not be required, but it's going to provide a very strong guideline on how you develop that solution and how the software itself or device itself is handled. And then both of these support the actual National Institute Handbook 150, which is the National Voluntary Laboratory Accreditation Program. So that's open. So you can go and download that, get access to it, and read through there. It will be helpful, once again, if you're designing some sort of actual electronic healthcare record solution. If you're not so much developing on there, it's useful to know, and we'll cover a little bit more into that as we actually dig into the electronic medical records. So this is where we'll get a little bit in depth on here. So we have a lot of different terms. So electronic medical records are essentially the digital versions of the paper charts that a clinician, a clinic, hospital, different providers utilize. It contains the information collected by that clinician, the doctor, the nurse, et cetera on there, and are provided just in that place for diagnosis and treatment. They're, they improve the overall healthcare quality because we're digitizing them. However, they still remain fairly local to that facility. So this is where we upgrade to electronic health records. So this includes all that data from the from the EMR side, and then moves it over as well, and provides the ability for them to, when the patient can have authorization to view or look on it. It's also accessible by reference by other covered providers. So meaning that if the patient's reference to go to someplace else, then that new clinic or facility provider can also see that same record. So now we move into personal health records on here. And the part on this really contains everything, but the key part is it's the EHR for the patient, right? So this is when we would walk out of the doctor's office with our medical file in hand. That's probably the best way to think of the personal health record. Same thing on there. The other big part is that we look at a lot of, so our phones, there's a lot of different devices out there that actually manages for us that we provide it. So for instance, for those of you that have iPhones, Apple's Health app on there will actually download and keep a lot of that information. And it can be utilized and updated to your electronic health records as well. So the Fitbit devices that are out there as well maintain some data and can provide and integrate on there. If anybody has a Bowflex out there as well, the Bowflex provides something similar as well on their different applications. So when we start looking at selecting electronic healthcare record solutions, it becomes a pain, to be very blunt on there. But there's actually a good playbook that the ONC provides, and this is back to the Federal Health Services on it, and it will go through and really help. So for one part, we look at the electronic healthcare record contracts and tangles. So it's kind of they try to make it a little bit lighthearted and a little bit fun, which, as we know, this isn't exactly exciting stuff, just stuff that we have to know and order private service a lot of times. And it will go through and review a lot of the different parts when they're looking at selecting a solution, things to be concerned about how you're selecting a solution and what it is that you should be worried about as far as compliance, regulatory aspect, or even all the way to signing, a business associate agreement on it as well and entering into as part of that healthcare system. So we look at a big part with the electronic healthcare records solutions that are out there is that we really do look at like some cloud versus local. Right? The cloud solution really presents a lot of confidentiality issues. And this goes back to our CIA model. And the reason being is that we don't have positive control over the stuff. And it's also a shared responsibility. So those of you that are utilizing Azure or AWS on there, then are probably very familiar with the shared responsibility model. And that provides a lot of liability. So if there is a data breach in some way, somehow, as unlikely as it is, there are significant fines that include a data breach when we're talking about electronic healthcare records. The local part is a part, this is our on-site, our on-premise, our company-owned data center. And the big problem here that gets overlooked is the actual availability part of the CIA security model. So with dealing with electronic healthcare records, you are required to provide a high availability for access to those records. So this becomes, if we're not looking like ultra variable networks on here, for instance, a lot of times British Telecom will utilize those lines. It's very simple. It's almost like a 56K modem line. However, it's extremely expensive, but it never goes down. It's very protected. And it's ran all the way across the continent on him. So this is the level of availability that we're looking at when dealing with electronic healthcare records. So the planning implementation side becomes a little bit interesting, and it's the only part emphasized here. Really want to make sure that governance processes are implemented at the planning phases. And the reason is that this ensures throughout the entire time of the life cycle. So we're looking at from design to moving, transfer to operations to continual improvement. It assures and mitigates the risks that come up through the entire process. This gives us a process, the governance process gives us a way to identify risk as they come up and manage them more effectively. And generally when we do a lot of different IT projects, we don't really focus on the governance process when we're in that planning phase of the project. With healthcare, we want to emphasize the governance process. We want to also emphasize the change management process because it gives us a way to test that change management process throughout the entire life cycle. So once the solution moves into the operation phase, the proper controls are identified, the proper management and security model is identified in place so that we're minimizing our risk on there. And if there is any sort of incident, we can identify when and where from both the historical standpoint and also have a process to notify the clients or whichever organization is required as part of that breach notification rule. And with both of these going into place, now we have a very strong continual improvement process as well. And that's going to be the key life cycle on there that helps avoid regulatory risk. So when new legislative comes out, with having these governance process and change management processes in place, the continual improvement process as part of that should be able to identify new regulatory risk so that you're avoiding any type of compliance incidents and risk there. So that, as that goes along, the migrating the data itself is actually going to be the key part. And the big parts that you want to look at is identifying retention aspects when you're moving from paper to an EHR. So securing the paper, looking at how long you want to keep it to make sure that you don't have any type of duplications, that your data integrity is not at risk, and then get rid of that paper, because as long as you have those paper records, you're providing a very large level of risk on them. So ID theft is extremely valuable business, and a lot of times we underestimate how valuable. Having those paper records and somebody breaking into a clinic to get those records, a lot of times from a professional standpoint in the security world, we suspect that most times that people are breaking into clinics, that they're not there to steal pharmaceutical aspects, they're actually stealing identity paperwork on there. So the amount of information on there, we can look at selling identities at almost $1,000 a piece for a good identity. Whereas we look at selling a lot of pharmaceuticals, they're not going at that high of a rate on darker markets and legal markets out there. So it's a key part to look when you're migrating your data, making sure that your retention aspects on paper documents or whatever system you're migrating is eventually removed completely, and then you have confidence in the new system. And then also to Dina's point as well, we don't want to delete data ever, but we don't want to maintain duplication of data either. That's a kind of a key part that becomes a little bit complex on there, making sure that you have the right data and your integrity is good, but also not keeping around data that is no longer required. So we'll go into the healthcare information exchange, a little bit more detail here. So the part in the way that it works is we have three different types of healthcare information exchange. We have direct, and this is where we're receiving records between care providers. So I go to the dentist tells me to go to an orthodontist, which might be the wrong term. I always get those two confused. And they, so I need surgery. This is where a direct type of healthcare information exchange model happens. Now going to, say I go to the emergency room, this would be a query-based. So this is discovery, like, hey, we have a patient here. What is happening with them? What kind of pharmaceuticals are they on, medications they have? What kind of prior medical history do they have? That's a query-based model of the healthcare information exchange. And then we have the consumer mediated, which essentially is to enable patients to get their own information. So this comes back to kind of looking at the iPhone app where you have Apple Health, being able to pull data instead of for your own self versus having to go to a doctor and ask them for it. So the key part that is included in the Century Curses Act on here is that it forces a lot of use of the healthcare information exchange and requires it. It also provides a very advanced trusted exchange framework that is, and they've snuck this in very well. So it's considered the trusted exchange framework and common agreement on it. So this essentially is going to help build a healthcare information network. So as we look at electronic healthcare records and solutions in the future, we want to be sure that we are reviewing their capabilities for this in order to meet the compliance requirements. And this essentially is that, I guess a good way to look at it is to think about the qualified healthcare information network providers as internet service providers, and the healthcare information network providers are the internet backbone. That's the model that's going into place, and that's part of what the Curses Act is encouraging, is to build something like this, some sort of model, and get the policy and structure in place. And the big part that's super beneficial from a security management part is that generally when we're sending electronic healthcare records, we're sending them in ways that would be very high compliance risk and a very high regulatory risk. Doctors will email these, which email is plain text. Even a lot of secure email systems that are utilized still provide a high potential of breach with those records that are being sent around. So the next part that we also see with the healthcare information exchange to provide a lot higher level of healthcare quality, as well as securing the privacy data, and why you want to try to go along with utilizing some sort of HIE with the electronic healthcare records, is that it provides ability to report data upwards as well. So this is looking at the Center for Disease Control, Center for Medicaid, Medicare Services, World Health Organization on there as well. So being able to report data up there to identify pandemic risk, various epidemic parts, to provide as we travel internationally to identify the risk that goes along with the electronic healthcare record. Risk was maybe we didn't have the immunizations we had, which introduces something into a new region in the world that normally wouldn't be there. It also provides, as you go through the trust exchange framework on there, it provides a lot of controls to prevent errors, right? So this is looking at, as you go to a doctor and they look at your electronic healthcare record, it's being able to say that this record's accurate, also not providing a medication that's going to conflict with another medication. So this goes back into the controls and making sure that how these records are sent are secure and very private, and that the patient has the ability to access them in order to make sure their vitality is in place on there. And when we look at these parts, is that this also provides a very large level of misuse of electronic healthcare records. So the healthcare information exchange provides a secure model to prevent the misuse. And when we look at misuse, this comes back to the identity theft factor, or coming back to identifying medications. So maybe a house break-in is based off of stealing the medications that they have, or identifying different, when we look at various organ exchanges, these are not necessarily, that typically are illegal and black market exchange of them, being able to identify them would be able to see the electronic healthcare records. So these are some of the risks that need to go into play when we look at utilizing electronic healthcare records and have access. So just kind of recap on some of these parts on here, is that, when we look at HIPAA and Curses Act is where you really want to focus around electronic healthcare records. HIPAA overall contains a lot of different other rules that are not necessarily applicable or provide additional complication to understanding what needs to be in place. on it, because we may not be concerned with the coding, we may not be concerned with a lot of different aspects on there, and essentially the building as well. But we do need to be concerned about the enforcement, the breach, the privacy, the security rules. This is where it comes into play, and where we need to review all the controls required and keep an eye on acts like HITECH and Services Act, where they're providing us a high level of regulatory risk, because these are not acts that were specific to healthcare necessarily. They were something that was slid in to another act for a totally different function. And that's where we catch ourselves in the electronic healthcare records and healthcare world, catch ourselves blindsided by countries, nations, putting a new legislative laws in place where we're not aware of them. And now our compliance risk is up, and we're failing to provide the appropriate service and control electronic healthcare records properly with all of our different covered entities and business associates. So we'll look at, so a lot of good resource out there is that there's the healthit.gov out there, as well as, which that is probably one of your stronger sites that you'll want to go to. ISC also provides Internet Security Consortium. I think that's still there. Provides a couple different training aspects for healthcare certification as well. I know our companies as well provide different training and awareness on different parts of security controls that go along with there. So it's always a good idea to refresh. I myself personally, I probably every other year or so, I go through and kind of brush up on different healthcare across different countries. A lot of times my focus is North America and Europe, Middle East, is my focus areas on there, but at other times we have to look at a wider spectrum on them, and just to get an idea of what type of rules in place. You'll also catch that a lot of the privacy rules that you'll see coming out are in line or supersede a lot of the healthcare controls. So it makes it pretty easy if you're looking at privacy. Just keep in mind that electronic healthcare records are going to be covered by any type of privacy rules, if not more rules and controls required. So we'll look at just kind of some interoperability and usability on here. And this main reason for this quickly is to look at the electronic healthcare records and type of security controls that we need in place. We don't always think about it in the way that we probably should. So there's a nice aspect of the Certified Health IT program that is provided by ONC out there. So generally it's mostly applicable to CMS and government organizations. Some NGOs have started adopting the framework. It is publicly available, and it provides a nice model that would be helpful for a lot of people to identify the controls. So this is the accreditation model that goes through on here. So it's something worth, if you're developing electronic healthcare record systems, if you're trying to adopt a solution on there, it's worth going through here and looking to identify what controls are in place, what requirements you should be focusing on in order to mitigate any compliance risk as part of utilizing electronic healthcare systems. And with that, here's some of the reference on here, which we'll get back up onto our site. And unless there's any questions or anything, I'll turn over, which I think we're going to do questions towards the end, if I'm right, Brian? And I'll
if anyone has any questions,
Brian.
Yeah, if anybody has any questions immediately, they can definitely use the chat button and reach out now, or they can ask their questions at the end. Does anyone have any questions at this moment? All right. Noah, thank you very much. That was great information and definitely,
Awesome.
Yeah, definitely helpful.
I hope that didn't bore everybody. We're still all awake. I know it's great, exciting information. It's always difficult. Will be honest, as everybody reads through a lot of the stuff, I will spend maybe 12 hours reading through a lot of the stuff and fall asleep at least 4 or 5 times throughout the 12-hour period. I'm just trying to read up and get caught up on all the different controls that are required out there.
Awesome. Well, thank you again for that. That was great information. And now we're going to go on to my bit. All right, so I'm going to talk about working with EMR developers from requirements to system launch and support. Get my video up here too. All right, so first a little bit about Archer and Cprime. Archer is an innovative technology consulting and custom software development company that helps startups and enterprises digitize healthcare. We've been in the software development space for about 20 years, working on more than 600 products across 300 plus clients. We can help you very early on when you just have this idea and you want to try and figure out if it's a marketable idea that you can bring to market. We move on to later phases where we help with the architecture, infrastructure, and the development of that product. And then later stages where we're helping you grow and scale your business and support your business. Cprime, our parent company, is a global consulting firm helping transforming businesses get in sync. Cprime is an expert in agile transformations, one of the premier resellers for Atlassian suite of products and services, and they support with collaboration tools. They help the transforming businesses with training and awareness, product strategy meetings with the key stakeholders at the clients. Who are the products for? How do you want to build it? How does it fit into your business? And how can we help you with that? So together, Archer and Cprime bring you tremendous value in moving your business forward. By merging ideas, technologies, and agile approaches, we develop success for our clients. Some of the main verticals that we work in: healthcare and life sciences, obviously, automotive and logistics, and fintech and IoT. And a lot of those segments have some similarities in privacy and data security, and definitely areas that we are experts in. And building an EMR system, EHR, you need the most premium, secure, and experienced people to be able to do that for you. When we talk about the full cycle of software development, a lot of people right now, especially in this environment where everybody's looking at technology to help with healthcare, and the rapid adoption of that technology over the last 6 months has been apparent to everybody. A lot of these technology tools were out there and were existing, but they hadn't been pushed on the public. This idea of doing a call with your doctor, a video call with your doctor, was foreign to a lot of people. But now that's been pushed into play, the need for technology to support and grow your medical businesses is more obvious than ever. So a lot of people are coming up with some great ideas right now to help in the medical space, whether they can be small ideas, big ideas. But the first thing you have to do when you come up with this idea is figure out how the market is going to respond to it. Are there actual market needs for it? Looking at competitor analysis, what are the competitors doing, and a gap analysis and what you want to do, what's out there, and where you're going to really fill in those voids. Looking at the solution design, how are we actually going to build this idea that you have? The UI and UX design, which, as we've heard from both Dima and Noah, simplicity in a UX design when it comes to medical and healthcare is so vital for your business. Because if it's too complicated, even just on a screen, if there are too many buttons to click, the odds of making a mistake grow exponentially. And that's the last thing that you want when it comes to EHR. You need them very much in sync, very highly accurate, and you need that data to be able to correspond to other systems and platforms as well. So doing wireframes for your UI and your UX, very, very important, and mapping that out. And of course, business model testing. How is your business model going to be received by the market? All those things come into play in the early stages of the product design, and taking that idea and bringing it to something viable that we can now move on to the architecture and development phase. This is where a lot of the cool, fun stuff happens, from system analysis and design. We have a suite of system analysts and business analysts who kind of live at the crossroads of business and development. They know development, they know engineering, they know all the aspects that go into building a product, but they also know practical applications to your business and how to combine both to make your business something that can be marketed and achieved and your goals surpassed. Of course, depending on the different platforms that you want your system to live in, from web development and mobile development, those are things that have to be mapped out. Maybe they can be combined in some ways, but oftentimes they have to be separated because the needs of clients who are on mobile might be different than somebody who's sitting in front of a computer. Any embedded development needs, and then of course, quality assurance and DevOps. All of that lives in this architecture and development stage. And this is also done in an agile methodology, where when you're building software, and especially in healthcare today, where things are changing every day, you have to think of your software as a living, breathing creature that's constantly evolving. And you build one feature and it sparks all these ideas internally and externally, and within Archer or your software development partner. Very important that they're bringing ideas to you as well, so that they're adding value to your entire development process. But once that architecture and development is underway and is actually at a good stage of your product, maybe we built an MVP, a most minimally viable product. Maybe it was just a proof of concept so that you could go out there and test your model on a limited capacity. But once we're at that point of developing and building your architecture and your product, now we have to think about business growth. How are we going to scale your business? How are we going to support it? And we're going to do that with things like team extension, and mapping out and planning how that team is going to grow, more QA people, NetOps team, support desk and help desk, and ongoing development. So all that takes place in the business growth stage. And of course, all that leads to having a hopefully very exciting product that you can successfully bring to market. While all of this is taking place and living within Archer's software development processes, Cprime is sitting there and helping you with your agile transformation. They're supporting all the collaboration, the Atlassian suite of tools. They're there to help understand how the business is transforming into this product-oriented, evolving and changing business that can adapt with the changes that take place in the market. So together, we bring you the suite of services from development and actually implementation and helping your business change and adapt. Some of the key drivers of the EHR implementation product success fall into these 4 categories. And you think that these 4 categories pretty much fall into any kind of vertical that you're working in. However, when it comes to medical, there are a lot of different compliancy and rules and regulations that have to take place and have to be implemented in this suite of these 4 pillars. So when we look at the team, having an experienced team in the medical field is very vital to understand how things are going to affect interoperability and speaking between different platforms, how the team is going to be focused on security and compliancy, whether HIPAA compliant and other things like that. The team, you need to have, like we mentioned, a strong UX designer who is not going to clutter your screen and make it complicated for the patients to select the tabs that they need, or those medical practitioners. They also need to be able to access the information very smoothly. So you need a team that understands all of that. The technology, obviously very important to support your business. So looking at the architecture and infrastructure that needs to come into play and where that technology is going to be utilized. Again, on the web, is it going to be mobile based? Is it going to be cross-platform? And looking at things like how big is the business going to scale, so we can set up your databases and the support structures to help that scaling and to see you achieve your business goals both immediately and long into the future down the road. When we talk about processes with EMR and medical in general, processes tend generally talk about internal processes working with the team. So that's everything from how you're going to communicate, how often you're going to have meetings, daily meetings, weekly meetings, sharing information with all the stakeholders involved, things of that nature. But processes also involve things like, how are you going to hire and fire people when they're dealing with highly sensitive medical data? So for instance, having a process already set up that if you have to fire a developer or somebody who's been working on the team, how are you going to immediately cut off all their access to this highly personally identifiable information? And that's going to fall into the processes section. Then you fall into then we look at the tooling. And of course, tooling consists of many different things. It consists of collaboration tools like Jira and Confluence. It can consist of the framework that you need to actually build your platform. And with medical, it's also talking about things like the vocabularies, which I believe it was Noah and Dima who touched on. Vocabularies are an explanation of the medical codes. And these can be very different when you go from one business to another, but standardization there is very necessary. So bringing in vocabulary tools that will provide those medical codes are very, very important. So these 4 pillars are vital to your success in implementing EHR in your company. The basic requirements for an EHR are pretty simple to explain, but they go very deep. And we're not going to get into the deep weeds today. Be more than happy to set up a call with anybody to go into your specific needs and to dive deeper into these different points that we're sharing. But first, EHRs should obviously have easy documentation and reporting layouts for practitioners and patients, as well, as we saw from Dima's slide that had information everywhere across the board. Somebody who's filling out a record, that's going to lead to much greater opportunities for mistakes. And we don't want mistakes when we're dealing with medical records. Vital that everything is true and on point and factual. And so you need to make this as simple as possible. You need to think out the processes and the roles and responsibilities for the people that are accessing the information. Do people just have reading ability? Can they write files? Can they edit them? Who can see what? Are you dealing with super administrators who can give access to different people? All of that really comes into play in this section and is very vital. You obviously don't want somebody viewing some personally identifiable information that they shouldn't be doing. And that comes in with figuring out the roles and permissions and properly segmenting those people into the buckets of information that they're only supposed to see or read, write, or edit. Patient-centric view in the EHR design is obviously very important as well. Being able to access and see the information simply. Simplicity is very, as much complexity as there goes into this, at the end of the day, that UI, that view for the practitioner or the patient has to be very simple, has to be very easy to use, and has to be focused on the patient needs. And of course, to achieve all of this, you need to involve developers who have this experience so that they can create a feasible EHR. The requirements for creating an EHR 6 months ago are different than what they are today and are going to be different than what they are 6 months in the future. And developers and engineers who are working on that and living and breathing those requirements are the people that you need, the team that you need to build to properly build your EHR. There's a lot of information on this slide, and in the nature of time today, I'm not going to go into the details, but all these slides will be shared with everybody, and I encourage you to look through them. And like we said, set up a call and we can discuss this in detail. But at a high level, the EHR development and integration obviously starts off with planning, requirements gathering, the needs and wants of your business, your goals. The individuals have thoughts and ideas, how you can differentiate your product, and what kind of services are out there. And you also need to understand right from the get-go certification and regulatory requirements. Then you have to figure out if you want to go with a already built solution that's on the market, or a custom built solution. And look, there are a lot of great products that are off the shelf that people can use. However, these are products that somebody else built, thinking that they have a general understanding of the industry and the needs of your business, that they built you something to work in a specific way. Oftentimes that's not the case, and oftentimes now, as everybody's trying to be competitive and try and advance the field forward, customization and building from scratch platforms is a very interesting opportunity for you to have a product that works exactly how you want it, that interacts with other systems exactly the way that you need it to operate, and that provides the information in that simplistic form for all the users of the system. So oftentimes, people that have a great idea and come to us to talk about it, when it comes to the actual complexities that are involved in developing and building a platform, whether it's timeframes, whether it's cost structure, whether it's the amount of time that somebody needs to put into it, oftentimes that can scare somebody. But at the end of the day, when you go down that route, you're getting the best in breed solution for your business, for your goals, and ideally some differentiating factors amongst the competitors that's going to set you apart. Now, once you contract with that vendor or IT partner, obviously you need to manage risks and liability, and we'll talk about that in a minute. You need to build out that development team. And again, you need to bring on experienced people who can help you and who have an understanding of everything that you're trying to do, the regulations, the compliancy rules, and all of that. And then you need to set up those interaction routines and processes, which I just spoke about before. And that goes from everything from your collaboration tools to your communication methods to your communication frequency, daily stand-up calls, weekly team meetings, etc. Moving on to implementing and adopting an EHR, obviously managing and protecting that data is of the utmost importance. Secure, safe, is most important things because you're dealing with very personal information. Developing the EHR and integrating it with other systems that you use are vital as well. And training and educating users. So who's using the system and how are they using it? Very, very important. And then of course, support and optimization. Once you have that system, there, you need to ensure that the system performance meets your expectations. And if you plan properly and you've had a experienced dev team, then those performance needs should be not just met, but exceeded. Quality assurance and bug fixing, you're always going to have bugs when you're building software. That's just a fact of life. So you need a team that can run constant testing, automated testing, and be able to respond and fix those bugs. And then of course, gathering feedback and enhancing the system. So gathering your client information, customer feedback, and being able to adapt your development based on those needs. When you're talking about the cost of EHR development from scratch, there's a lot of different factors that go into play, from the complexity of it, the functionality and use cases, the number of user groups, the different number of platforms that you want the platform available on, the different systems to be integrated with, and that will always change the costs and the timeframes for building and developing and launching your product. Looking at the infrastructure setup, and of course, the number of people on the support team. So all very important factors. Requirements management, and again, I'm not going to get into the weeds here, but multi-level requirements approach is really the most important, is really a best in breed way to go. You want to map out your requirements at a minimal level. So just some user stories, enhanced with technical details and constraints so that you can have a visual of what your product might look like. Getting into more standard requirements approaches, so workflows and requirements documents, and actually having those system requirements mapped out and documented so that you can have your platform built. Testability, of course, is very important as well. And maximum requirements approach, formalized documentation, use cases for the features, and more data flow diagrams, API points, all very important in the requirements management. Then we move on to risk management. This has come up a few times, and risk management in healthcare is very, very important. Obviously, again, because of compliance and rules and regulations, but when a software development team is looking at the goals of your product and how to build it or bring it to market, they're looking at all the various tasks involved, and they're looking at and writing down any challenges that might come into play when trying to achieve those goals. We have 3 different categories of risk. Positive risk is where perhaps a client has a preconceived notion of how they want something done, and the developers are looking at that and going, yeah, there's no way that we can do it that way. However, we can do it this way. And this way actually turns out to be much more efficient and effective. Maybe it's less expensive. Maybe it's getting that product to market that much quicker. But it's a positive risk factor, if you will, in getting what the client wants built. But better is always better. Negative risks are unforeseen, are things that we are anticipating, but we can't really foresee how they're going to play out. So it might be an integration with a system that we're waiting on the documentation, waiting on the company, trying to figure out how that's going to come into play. Risks that might extend the deadlines for and timeframes for development, or critical risk factors that might actually make it impossible for that project to succeed as it is written out. So we need to look at that and make those changes accordingly. And no risks are factors that we're identifying but aren't coming into roadblocks in terms of the development. Now, when you're looking at how you're going to your budget and how you're going to pay for this, there are 2 different types of methods. One is a fixed price contract, and fixed price contract is tricky because you're committing to a particular budget and you're not really allowing any room for moving the business as the needs change. As you build a feature and you realize that now you're identifying 3 other features that need to be built based on that and based on client feedback. With a fixed price, it's really hard. But when you go with time and materials, this is where you're getting your software development partner to commit to the delivery and quality of the needed functionality, with adjusting fast and within the budget constraints if the requirements change. And let's face it, requirements are always changing. Anybody who has gone through software development processes realizes that what you're initially planning out, a lot of that does wind up coming out in the product at the end of the day, but changes are always taking place. And you think you want to go one way, but then you wind up going the other way. And with time and materials, that allows us to work within those areas and be flexible, be open to change requests and feature requests and things of that nature. When Archer is putting together a budget estimate, we put together everything in as a transparent way as possible. We work with our clients as partners. We want to see you achieve your goals both now and down the road. We want to be there with you every step of the way. We're not just about coding for you. We're about bringing added value from our 20 years of experience and expertise to the table as a value add. So have you thought of this? Have you thought of that? You know, this that you're thinking of really isn't going to be applicable to your business, things of that nature. And we spend a lot of time figuring out your business, your needs, the actual workflow of your users, the system, and all of that. So we put together a highly accurate budget estimate that has a high and a low number of hours. Again, as development needs change throughout the life cycle of development, those hours can change, but we account for some of those changes already, and we give you a range of hours that the project is going to fall into. We break them down based on the different categories for management, testing, DevOps, risks, cleanup and acceptance, and development. And then under there, we go into the specific line items for the development features, functionality, and the deliverables. And we're also showing you the team makeup and the time frame to get your product to market. From there, we're looking at the tools to control the project's budget, timeline, and quality of the delivered EMR system. Again, I'm not going to go too into detail here, but solutions like Jira and Jira Reports, and a system like Archer Producer, which is a platform that Archer Software built and we use to allow our clients to full transparency and visibility into the development and where things stand. So doing things like Jira Sprint Reports, sprint planning, daily stand-ups, statuses with different senior management, all very important, and all want to be planned out and mapped out as well. So everybody has full understanding and is on the same page as to how this is going to play out. No surprises and full transparency, very important. Very quickly, some reporting samples on a Jira task force. This is looking at the different stories, which are the different tasks involved in your product, the status of those products, of those tasks. Are they completed? Are they in progress? Are they yet to be started? And then some other information on the complexities of those tasks and stories, the estimate on how long that will take, and where that is, the progress reports. And available to our clients and partners, again, so they can see everything that's taking place. This is not about a black box development. This is about a partnership and working with you every step of the way. Burn down charts are another great visual to see how the project is moving along, how your time is being spent, and what kind of remaining time is left. This at a glance shows that those numbers are the time remaining is going down, the time worked is going up. You'll see things in here that indicate maybe a feature request was added to the system, so it's adding remaining time, or maybe a feature was dropped, so it's going to reduce the time that's left. So a nice visual to look at. A reporting sample, build time control. So this is showing for our clients in the Archer Software Producer platform what has been done line item by line item, the date that they've been completed, and how many hours have been worked, and a report on that. Were there any issues? Was it tested? Does documentation need to be reviewed? Things of that nature. Reporting invoices. So these are all the invoices that our customer will have received during the development life cycle, accessible anytime, and shows a lot of great information as well. And then we have something, reporting samples feedback. We want feedback from our partners, our clients and customers. If a company is not looking for feedback from their partners, then you should probably raise the yellow flag, if not the red flag. Why don't they want your feedback? We want your feedback every step of the way, during sprint cycles, during product releases, feature releases. We want to know how you think about our development with you: performance, informativity, responsiveness, proficiency, involvement. If we see that something gets filled out negatively, our senior management team is jumping in to help and figure out what's going on. How can we throw more resources at getting this done right? How can we figure out what went wrong and make sure that doesn't happen again? And this is a great, great tool. And again, just speaks to the transparency with which we operate. And in the nature of time, that is a high level about Archer, about Cprime, and about working with EMR and health IT developers from requirements to system launch. So I'm going to ask if anybody has any questions. And otherwise, I see that people were having to. Do we have any questions?
And there is one question, I guess it's for Noah, on the question and answer section. Oh, it's answered. Okay, never mind.
Oh, here's an interesting question. What happens to the data if either party is no longer in business, the healthcare provider network, or even the IT company? Dima or Noah, would you like to address that one?
Yeah, so that was the one on there for Dr. Saeed on there. So I just kind of posted that answer on there. It is a unique scenario. I have dealt with small companies that were developing patient quality software, and they ended up going bankrupt in which case the data was returned to the covered providers on there. But it does provide a very unique scenario, and it also would indicate a lot of times that there is likely various, there's gonna be various violations in most areas with that aspect on there, or the government with the company that is being dissolved, the local government would essentially take that data and return it back. And that's in accordance with the World Health Organization side and a couple other larger international groups, so like the Joint Commission as well on it. And but it is a very unique scenario. And do I don't know if you have any other, maybe some other insight on there as well.
Dmitry, anything to add?
Nope.
Excellent. Thank you, Noah. Does anybody else have any questions before we wrap up today? We're going to get these presentations out to everybody so you can look through them in detail. And then Noah, Dmitry, and myself are fully available to set up calls with you and discuss how we can help you with your business needs, with your agile transformations, with your development needs and goals, whether it's whether you're early stages in the idea phase, or whether you're in later stages, you're ready to build your product, or you're growing and scaling your business. We'd love the opportunity to speak with you and share how we can help you. And by doing so, we're helping advance the healthcare industry and helping people at the end of the day. And I think that's what we're all in this about, especially within this industry. So if we don't have any more questions, then I'm going to say thank you to everybody for attending. Again, we'll get this information out to you, and it has our phone numbers and contact information. Please feel free to reach out and allow us to have a conversation with you and see how we can help you and work together. We appreciate everybody's time today, and thank you for attending. And we hope everybody has a lovely day and stay safe, stay healthy, and stay happy.